Did you know that a silent heart attack could be forming right now, without you even realizing it? Imagine being at risk with no obvious warning signs, just waiting for a moment when the situation could become critical. The 10 signs of a silent heart attack that you'll learn about today are crucial for identifying if your heart is sending you danger signals. In this video, you'll understand how these signs might be hidden in your daily routine and what you can do to prevent them. Don't let the absence of obvious symptoms put your life at risk. By knowing these signs and seeking medical advice, you can protect yourself and ensure your health. Watch until the end and discover how to act now to protect your heart. Silent heart attack. The danger you can't see. Imagine this. You're living your life normally, going to work, taking care of the house, enjoying your outings. Everything seems fine, but what you don't know is that your heart is silently battling an invisible enemy. This enemy is the silent heart attack, a type of heart attack that hides from you. Unlike a classic heart attack, which is usually accompanied by sharp chest pain, a silent heart attack acts like a sly and stealthy thief. It comes onto the scene without making any noise or obvious signs that would catch your attention. It's as if your heart is being invaded by an enemy you can't see, causing damage while you continue with your life without noticing. This type of heart attack can be particularly treacherous because many people never experience that classic chest pain associated with a heart attack. Instead, you might not feel anything unusual, and that's exactly where the danger lies. The heart continues to be harmed without your awareness, and the damage can be significant and even irreversible by the time it's finally discovered. People with diabetes, high blood pressure, high cholesterol, or a family history of heart problems are particularly at risk. Even if you don't feel pain, a silent heart attack is there, working in the background and harming your heart health. Without an obvious pain, the condition can go unnoticed until it becomes a serious problem. That's why prevention is essential. Regular checkups and careful attention to subtle signs your body might be trying to show you are crucial. Staying alert and proactive about your health can help identify problems before they become a bigger threat. Now that you have an idea of what a silent heart attack is, let's explore some signs that might indicate something is wrong with your heart, even if they're not as obvious. We'll discuss a crucial symptom that could be giving you a warning, even if it's in a subtle way. I noticed you haven't subscribed to the channel yet. Don't you want to stay updated on how to better care for your heart? Prevalence. Silent heart attacks are more common than you think. Imagine this scenario. Every year in the United States, about 805,000 heart attacks occur. These numbers alone are alarming. But what many people don't realize is that within this impressive figure, there is an even more concerning subset. 170,000 heart attacks are classified as silent. Yes, nearly 1 in 5 heart attacks happens without those classic signs we all know, like sharp chest or arm pain. Think about that for a moment. While many people are going about their daily lives with no apparent pain or discomfort, their hearts are undergoing a silent attack. It's as if a storm is forming in secret, without any fanfare, while life goes on normally. And the worst part, often, these individuals don't seek medical help because they don't realize something serious is happening. The silent heart attack causes damage to the heart quietly, and this damage can accumulate until it becomes severe and often irreversible. These numbers are a call to action. How many lives could be saved if more people were aware of the risks and subtle signs of a silent heart attack? The fact that almost 1 in 5 heart attacks does not present traditional symptoms makes the need for awareness and knowledge about heart health even more crucial. Every day is a new opportunity to learn and pay attention to the signs our bodies give us, even if they are subtle. Information is our greatest ally in the prevention and early detection of heart problems. Speaking of subtle signs, did you know that pain in the neck, jaw, or back can be an important warning that your heart isn't well? Let's explore this topic and understand better what these signs could mean for your heart health. If you're concerned about your heart, give us a like to show that you're committed to taking care of your health. Excessive fatigue. When tiredness is more than just tiredness. Imagine this. You wake up in the morning, get ready for the day, and even after a good night's sleep, you feel completely exhausted. You haven't done anything particularly tiring, yet fatigue seems to have taken over. This kind of fatigue might seem common, but if it becomes a constant in your life without a clear reason, it's time to pay more attention. Excessive fatigue can be more than just a sign of lack of sleep or stress. When the heart isn't functioning properly, it has to work much harder to pump blood throughout the body. Imagine your heart as an old water pump that needs to be operated manually. If the pump has problems, you need to apply more force to get the same result. This extra effort can make you feel tired and drained, even if your body hasn't been physically exerted. This type of exhaustion is often confused with stress, poor sleep, or a hectic routine. However, if you experience extreme and persistent fatigue and can't pinpoint a clear cause, it could be a sign that your heart is in trouble. It's as if your body is sending a silent alert that the engine is overloaded and needs attention. For those with risk factors like high blood pressure, diabetes, or a history of heart disease, extreme fatigue should not be ignored. It could be signaling that your heart is overworked and struggling to function properly. Now that you're more aware of the signs of excessive fatigue, let's explore a symptom that can be a clear indicator that your heart is facing difficulties. Chest pressure or tightness. Let's better understand this symptom and what it could mean for your heart health. Chest pressure. What you need to know about this symptom. Imagine a regular day. You're going about your normal activities when suddenly you begin to feel intense pressure in your chest. It's as if a huge weight is pressing on your heart, a sensation that can range from mild discomfort to sharp, oppressive pain. This symptom can be more than just a passing nuisance. It could be a critical sign that your heart is in distress. Chest pressure is one of the most commonly associated symptoms of a heart attack. Often described as a feeling of tightness, this discomfort is concentrated in the center of the chest and may last for a few minutes before disappearing, only to return later. Imagine a growing pressure, as if an invisible hand is constantly squeezing your chest. This sensation can be distressing and alarming, and it should not be ignored. This type of pain occurs because the heart is struggling to get enough oxygen. When there is a blockage in one of the coronary arteries, blood flow to the heart muscle is interrupted, causing the heart to become stressed and painful. It's like trying to breathe through a partially blocked hose. The extra effort the heart has to make causes pain and discomfort, signaling that something is seriously wrong. Although chest pressure is a critical sign, it's important to remember that not all chest pain is related to heart problems. Sometimes, the pain can be caused by issues with the esophagus, lungs, or even stress and anxiety. However, if you experience this pressure along with shortness of breath, excessive sweating, or nausea, it is crucial to seek medical attention immediately. These combined symptoms may indicate an emergency situation that needs urgent treatment. Now that you understand the seriousness of chest pressure and the signs that may accompany it, let's explore a symptom that can occur alongside this pressure and is also an important alert. Excessive sweating. Let's find out how this symptom may be related to heart problems and what you should do if you start experiencing it. Let us know how your heart is doing. Your experiences and feedback can help others understand body signals better and take care of their health. Share with us what you've been feeling. Sweating. What unexpected sweating might be telling you? Have you ever found yourself sweating even without exercising or being in a cold environment? If this happens frequently, it's time to pay attention, as this unexplained sweating could be a sign that something is wrong with your heart. When the heart struggles to pump blood due to a blockage in the arteries, the body has to work harder to maintain proper internal temperature. This extra effort can cause you to sweat more than usual, even when you're at rest or in a cool environment. This type of sweating, especially if accompanied by other symptoms like chest pain, shortness of breath, or nausea, could be a warning sign of a silent heart attack or other heart problems. The body is trying to cope with the extra load, and in some cases, sweating is a way to signal that something is wrong. If you notice that you're sweating more than usual, especially without a clear reason, it's important to stay alert and consider the possibility of a more serious issue. Keeping an eye on this and other signs can help detect heart problems before they become more severe. Now, let's discuss a symptom that can be easily confused with other issues but may also indicate a heart problem. Feelings of bloating, nausea, or changes in appetite. Swelling, nausea, or loss of appetite. What these symptoms might reveal. Have you ever experienced unexplained swelling in your legs, ankles, or even your abdomen? Or perhaps you felt persistent nausea without an apparent reason, or a sudden loss of appetite. These signs might seem like common digestive issues, but they could actually indicate that something is wrong with your heart. Let's explore why these symptoms might be more than just simple discomforts. Imagine this scenario. You wake up in the morning and notice that your ankles are more swollen than usual. Throughout the day, you feel constantly full, even after a light meal, and start experiencing persistent nausea. It may seem like a temporary discomfort, but what your body could be trying to tell you is something more serious. When the heart can't pump blood efficiently, it can cause fluid retention in the body. This fluid buildup can manifest as swelling in the legs, ankles, and even the abdomen. An overburdened heart struggles to maintain proper blood flow, leading to fluid accumulating in the tissues and resulting in visible swelling. Additionally, poor circulation caused by heart failure can reduce blood flow to the digestive system. This makes you feel full even after eating a small amount and can lead to a loss of appetite. Your body, trying to prioritize oxygenating vital organs, diverts blood away from the digestive system, resulting in a feeling of fullness and nausea. If these symptoms suddenly appear without a clear reason, it's crucial to stay alert. They may be signs that your heart is facing difficulties and needs attention. Fluid retention and changes in appetite are indicators that the heart might be compromised, and if left untreated, they can lead to more serious problems. Now that you understand what these symptoms could mean, let's explore a sign that might indicate a lack of oxygen in the body, manifesting as weakness or dizziness. Dizziness or vertigo. What your body might be telling you. Have you ever felt dizzy or experienced a sensation of the environment spinning, even without standing up quickly or being in motion? These symptoms, which might seem harmless at first, could actually be signs that your heart is experiencing issues. When the heart struggles to pump blood effectively, the oxygen flow to the body, including the brain, can be compromised. This can cause dizziness, vertigo, or even a sensation of fainting. It's as if the brain is receiving less oxygen than it needs to function properly, resulting in that feeling of imbalance. These symptoms can occur suddenly and without warning. Sometimes, they are accompanied by other signs, such as shortness of breath or chest pain. If you frequently or intensely experience dizziness, especially if it occurs alongside other symptoms, it's crucial to see a doctor to check what might be happening. Ignoring dizziness can be risky, as it might indicate that the heart is not functioning properly, possibly due to a silent heart attack or another cardiac condition. Paying attention to these signs and seeking medical help can be crucial in avoiding more severe problems. Since we're discussing symptoms that could be signs of heart issues, let's now explore one of the most unsettling signs: difficulty breathing, which might indicate that your heart is struggling to cope. Shortness of breath. What this symptom might be revealing. Imagine this: you're sitting comfortably, maybe watching TV or reading a book, and suddenly, you start to feel short of breath. You haven't been running or exerting yourself in any way, so why do you feel like you're struggling to get enough air? This sensation, especially when it appears without an obvious cause, can be more than just a minor inconvenience. It might be signaling something serious about your heart or lungs. When your heart isn't pumping blood efficiently, it can lead to a condition known as pulmonary edema, where fluid accumulates in the lungs. This buildup of fluid makes it hard to breathe, as if you're trying to inhale through a constricting fabric. You might feel a heavy weight pressing down on your chest, struggle to take deep breaths, or experience a sensation of being suffocated. It's like your lungs are trying to do their job under a thick, damp blanket. Shortness of breath can occur even when you're at rest or engaging in light activities, such as climbing a few stairs or walking around the block. The feeling might come and go, or it could persist and get worse over time. It's not just about the physical effort. It's about the heart's ability to keep blood flowing properly, which directly impacts how well your lungs can oxygenate the blood. But shortness of breath isn't always a lone symptom. Often, it can be accompanied by other troubling signs, such as chest pain, excessive sweating, or nausea. When these symptoms appear together, it's a red flag that your heart might be under severe strain. Think of it as your body's way of sending out an urgent distress signal. If the heart is struggling to maintain an adequate blood flow to the lungs and the rest of the body, it will show in your breathing patterns. It's important to distinguish between shortness of breath caused by heart issues and other respiratory conditions like asthma or bronchitis. However, when shortness of breath is paired with symptoms related to the heart, it can indicate a more serious cardiac problem. If you find yourself experiencing persistent shortness of breath, particularly if it's accompanied by other concerning symptoms, seeking medical attention immediately is crucial. Early diagnosis and treatment can be vital in preventing serious complications and protecting your overall health. Now that you understand the implications of shortness of breath, let's turn our attention to another physical symptom that can also indicate heart issues: swelling in the legs, ankles, or abdomen. We'll dive into how this common but significant sign can be connected to your heart's health. Stay tuned to learn more about what your body might be trying to tell you. Swelling in the legs, ankles, or abdomen. What this symptom might reveal. Picture this: it's a regular day, and you suddenly notice something strange. Your legs and ankles are swelling up, seemingly out of nowhere. Even your abdomen feels unusually full. This swelling, known as edema, might seem like just an annoying inconvenience, but it could actually be a significant warning sign that your heart is struggling. When your heart isn't working properly, it can't pump blood effectively throughout your body. Imagine your heart as a pump that's not doing its job right. If the pump isn't working well, blood starts to accumulate in places where it shouldn't. This is why you might see swelling in your legs, ankles, or even your abdomen. Areas where fluid tends to collect when the heart isn't functioning correctly. This swelling isn't just a discomfort. It's a crucial clue that something might be seriously wrong with your heart. When blood doesn't flow properly, fluids build up in your tissues, causing that heavy, puffy feeling. It's like your body is sending out an SOS, trying to cope with a problem that, if ignored, could get much worse. If you start noticing this kind of swelling, especially if it's paired with other symptoms like shortness of breath, chest pain, or extreme fatigue, it's essential to seek medical attention immediately. Your body is signaling that it needs help, and acting on these signs quickly can be crucial for avoiding more severe complications. Think of it this way. Your body is like a well-tuned machine, and swelling is one of the warning lights that something might be off. By staying vigilant and responding promptly to these signals, you can take control of your health and prevent more serious issues down the road. Now that you're aware of what swelling in the legs, ankles, and abdomen might mean, let's look at another symptom that might show up alongside these signs: unexplained sweating. This could also be an important indicator of heart trouble, so stay tuned to find out more. Stay alert to these signs, and don't hesitate to take action. Your health and well-being depend on it. If you found this information valuable, be sure to like the video and subscribe to the channel so you can keep up with essential tips for taking care of your heart. Thanks for watching, and see you in the next video.